In January this year, the president of Uganda announced the full reopening of the economy after almost 2 years of lockdown because of the COVID-19 pandemic. One of the conditions for reopening included adherence to the COVID-19 prevention protocols and responding to the vaccination call. According to the Minister of Health, as of May this year, over 20.9 million doses of COVID-19 vaccines have so far been administered to the people across the country. Officials from the Ministry of Health have also revealed that they will roll out a vaccination exercise for 6.6 million school-going children aged 12 to 17 at the start of the new school term.
The wave of vaccination is going to be school-based approach. We are going to do massive vaccination, but we are going to use the schools as our focal point. So the secondary schools will be the focal point, and the proportion of people who are in that age category who are not in school, that category we estimate 6.6 million people to be vaccinated who are between age 17 and 12, and we shall reach them to the nearest school will be a nearest post.
The school-based vaccination program follows what the Ministry of Health says has been a successful vaccination campaign against COVID-19. The ministry says over 14,000 children have contracted COVID-19 since the onset of the pandemic in the country.
We need 119 million doses. 119 million doses to vaccinate people 5 years and above in this country. We are going to start by vaccinating people who are between 12 and 17 when the school term opens.
When you look at the childhood immunizations we offer, the under 1 year old, there are some diseases that have never been seen. I'm older than my director, but I think even in his practice, he has never seen a case of diphtheria in his lifetime. But it's being managed by the vaccination we give. So some of the vaccination we are giving, like for the under, I'm just giving an example, people are not seeing the diseases manifesting in the children because they are being well managed through vaccination.
Dr. Chabayinze, who is an expert in monitoring infectious diseases, also predicts another wave.
When is the next wave? We knew there would be a wave, didn't we know? And we said the disease comes as waves. We have had influenzas. This is an influenza type of disease. We've had influenzas in the world before. So we know how they come and spike in terms of waves. Surely after 2 years, you can now start predicting that within this time frame, you see now China has some cities under lockdown. According to Chabayinze, government has chosen to roll out the Pfizer vaccines. We are going to use Pfizer vaccine because it's the one which has been extensively and studied used in that age group where we have relevant information. Other countries like China are only using their farms, Sinopharm. Other countries like Russia are using their Sputnik. But we're not using them here. We'll use those which are accessible. Kenneth Muhongi, the executive director of HEPS Uganda, says they will help advocate for vaccine production waivers to increase production of generic vaccines and their distribution and supply.
This program is there to support government to ensure full vaccination, right from production, advocating for those TRIPS waivers to increase production through generic production. The supply chain, he has told you of the challenges they face once they take out these medicines from the cold chain or these vaccines. They require to be consumed within 30 days. So that calls for a very explicit and a well-coordinated mobilization and supply chain.
On March 10th last year, the government began a massive vaccination program that would see close to 22 million people, all 49.6% of the country's population vaccinated against COVID-19 in a phased approach. At that time, priority was given to all the country's health workers, all teachers and personnel of the armed forces. Shomim Natebwa, Owetendo, CTV, PM Edition.